Hello, I am Deputy Commissioner Jennifer Lackard from the Mount Vernon Police Department. And on behalf of our Police Commissioner Glenn Scott and Mayor Sean Patterson Howard, I would like to welcome you to our Health and Justice Virtual Roundtable on Co-Occurring Disorders. The Health and Justice Virtual Learning Series is produced in coordination with the Mount Vernon, New York Police Department's Behavioral Health Advisory Council. This council consists of over 30 public and private stakeholders representing organizations from across the city of Mount Vernon and the county of Westchester, New York. All of these stakeholders are committed to providing solutions at the intersection of public health and public safety. My role here at the police department is to identify solutions which will help law enforcement to improve their service delivery to persons in crisis and vulnerable populations in our community. We hope and ask that you join us and participate in a 90-minute discussion today. If you have questions from our esteemed panelists, please drop them in the chat and we will ask them at the end of our session. Again, on that note, I am going to turn it over to Chris John, Dual Recovery Coordinator for the Westchester County of Department of Mental Health.
Good evening, everyone. As DC Lackard said, I'm Christopher John. I'm with the Westchester County Department of Community Mental Health. It's an honor to be with everyone tonight. So I am as mentioned, the Dual Recovery Coordinator. And as part of the local government unit for Westchester County, what we do is we provide a lot of service and support to our behavioral health providers within Westchester County. Much of that focus that we're doing with the county is really focusing on what co-occurring disorders are and moving towards a system that is integrated and really provides the care and service to people who are vulnerable and really need this service. To better help you understand the direction of what today's forum is going to be in our roundtable, I want to help you understand what co-occurring disorders are if you haven't heard of it before. A co-occurring disorder is a combination of one or more mental health challenges and substance use and addiction. What that typically means is that a person is living with both a mental health and a substance use addiction at the same time. And that can be very complicated for a lot of people to live with, but also to navigate. And it's best for us as a system to recognize that this is something that exists for 70% plus people who have these conditions, either or that a person that's living with a mental health condition may have a substance use disorder and vice versa. And what DC Lackard from the Mount Vernon Police Department, as well as many of our partners that's going to be here today, is helping us to recognize how do we understand this condition, but also what are the services and the supports that we are putting into place to help support people in need. One of the other things I want to just quickly add is that many of the roundtable participants are part of something that's called the Co-occurring Systems of Care Committee, which means that we have many stakeholders within our county who are coming together to really address this need. And you're going to see that play out today with our roundtable. So I want to move this forward and let's get this started. I want to introduce some of the members of our roundtable who will share their experience and lend insight to this important discussion. I'd like to introduce Dr. Kim Smith, who is actually going to be joining us in a bit. She's having a bit of some technical issues, but when she joins us, she is the Assistant Superintendent for Pupil Personnel Services at the Mount Vernon City School District, and she sees firsthand the impact of co-occurring disorders on our youth. Additionally, Joanne Dunn. She is the Executive Director of the Youth Shelter Program for Westchester. She works to support and foster growth in our teens and young adults who are court involved. She will provide a key perspective on the importance of appropriate and person-centered treatment for those the youth shelter serves and who have co-occurring disorders. And from the treatment side, we are fortunate to have Felice Harris, and who is the Director of Integrated Services at the Guidance Center of Westchester, and Dr. Drew Mullane, who is the Director of Innovation, Integration, and Community Partnership at Westchester Jewish Community Services. Both have been leaders in ensuring that the pilot of Encompass, which we're definitely going to be going into a little bit more, which is an evidence-based treatment model for teens and young adults with co-occurring disorders, is being used throughout Westchester, including Mount Vernon. And finally, I'd like to introduce and welcome Stephanie Marcasano. She is the founder of the Harris Project. The Harris Project supports young people who face this combination of mental health challenges and substance misuse. I'm confident that each of our participants today and guests will provide a very unique perspective on this issue that we're bringing up. So I'd like to start off this discussion with starting off with Stephanie Marcasano, again from the Harris Project. Through her organization, Stephanie has created integrated prevention programs and comprehensive services addressing mental health challenges together with substance misuse and addiction. But tragically, this mission began with the loss of her own son, Harris, to drug overdose. Stephanie, can you please share with us your story and how it led you to why we're having this discussion today?
Sure. Thank you so much, Chris, and thank you, DC Lackard, for putting this together. I think it's really powerful that the first health and justice conversation is one around co-occurring disorders. So I am a mom who lives in Ardsley, New York, not far from Mount Vernon, and my son had struggled with an anxiety disorder and ADHD when he was young, and ultimately turned to substances to self-medicate. It's something that is very common. It has a name. It's called co-occurring disorders, when you have one or more mental health challenges and substance misuse and addiction. And when he died, everybody wanted to know what they could do, how they could support our family. And in the chaos of what was going on, my daughter was a senior in high school, my son is 19, my husband, everybody's kind of flooding our home. I thought every program he went into said he has this thing called co-occurring disorders. Every program said that they treated co-occurring disorders, yet somehow within a year and a half of entering the substance use treatment world, my son was dead. And for me, it was really important to keep other families from going through this, to really empower young people to understand pathways to substance misuse and addiction. I'm an attorney by training. I'm a former PTA president and school board member. We used to bring in programs and think that we were really making incredible impact with our young people, but I sort of started feeling like we were doing something wrong. And so when I sat at my kitchen table and started doing this, I literally thought, how are we going to empower our young people to understand mental health and substance misuse and addiction? And how can we impact the treatment model so that when people enter the system of care, things can be totally different? And so I founded the Harris Project with a single mission in mind, which was to change the conversation. I got connected to the Department of Community Mental Health very early on and worked with Commissioner Michael Orth to actually begin to do the work. We created CODA, Co-Occurring Disorders Awareness, which is our prevention programming, which is really positive and impactful with our school districts. And we have been funded to bring in evidence-based treatment, which we do right here in Westchester County, which you'll learn more about. And then we actually work to change the entire system so that when families and individuals enter, you look at the whole person, you look at their mental health, you look at trauma, and you look at substance use and how they impact each other and treat the whole person at the same time. I did not anticipate what happening, which is hospitals, agencies, providers, school districts, community organizations, they really wanted to be part of the movement and they joined. And so I co-chair the Westchester Co-Occurring System of Care Committee, and I work with our Mid-Hudson region to actually impact the system of care, and then at the state level to be an advocate to actually bring together our state departments, our Office of Mental Health and our Office of Addiction Services and Supports. So thank you so much, Chris, for letting me kind of tee up the conversation and to kind of share how a parent can make impact even without formal mental health and substance use training.
Stephanie, thank you for sharing your story, and also thank you for sharing what you're doing with the Harris Project to support people who are living with co-occurring disorders. You have a very strong and impactful experience in a story. And many of the people that are listening to this right now may be in a similar situation and not knowing what to do, and probably want to know, how do they recognize something that's going on in their family member and their child, that may be living with the coring disorder and may be hearing this now for the first time. As a parent, what do you feel was missing in the system, that maybe was a challenge for you to get to this point?
So I think every family story is different, but for me, we were very comfortable and aware of the struggles that Harris was having with his mental health. So we didn't live with the secrecy and the shame that a lot of people do, which we work to change that whole stigma thing. But for us, we were very kind of public. But Harris didn't look like a young person who was struggling with an anxiety disorder. Like, everybody thinks they know what it looks like, but some young people who are like out in the world, very kind of like loud and aggressive and funny, they're really masking the anxiety and what they're feeling on the inside. So there was a real lack of understanding in the community about what he was going through. And then when we go and seek treatment, not one provider ever said, a young person like you, a family like yours, like Harris was good looking, social, athletic. They never said a kid like you might turn to substances to self-medicate. Like, you're not going to look to party. You're going to be able to, you may be looking to go to the party feeling comfortable in your own skin. Those beginning conversations, had he really understood the impact of marijuana use on his brain, on later opioids and prescription medication, that would have been the first opportunity to do things differently. And so for families, I say, if you feel like there's something going on, get connected to mental health resources. If your child is seeing somebody and you're not seeing marked improvement, get another name. Like, only with our mental health do you get a name scribbled on a piece of paper. You go to see them, and if you don't start feeling better, you blame yourself. Like, what am I doing wrong? No, there are professionals that do the job better and those that don't. And so it's really important to be an educated consumer about the services that you're looking for.
Stephanie, again, I thank you so much for sharing your story. Of course, creating the Harris Project in honor of Harris, but also in response to Harris's experience. So I definitely want to come back to you a little bit later to ask a little bit more what you're doing in bringing this to the Mount Vernon community, and anything else that we should know. So I'd like to transition over to Dr. Kim Smith. Is Dr. Kim Smith with us at this point? Great. How are you?
Good evening.
Glad you could make it. So Dr. Kim Smith, I said, is going to talk about the impact of mental health and trauma on substance misuse with students in the Mount Vernon City Schools District. Can you share with us some information?
Yes, I can. This is a very well, first, let me say hello, Mount Vernon. I am delighted to be here. Thank you so much for the invitation. As the assistant superintendent for pupil personnel services, I work on a daily basis with our students, their parents, family, and all stakeholders. For the most part, especially during this pandemic, we have lots of concerns about our students and their mental health. And of course, our students self-medicate. We have a cadre of individuals who work within the district with the students. To begin with, we have a drug abuse counselor, Maxine Cole Wilshire, as well as our guidance counselors, our social workers, our psychologists, teachers. Everyone is invested in our superintendent, in our students. Our superintendent leads the charge, and we are very concerned about that. Simultaneously, we have partnerships with community agencies such as the Guidance Center, WJCS, the Rockland Psychiatric, and we make these referrals. We're seeing an increase in mental health issues, not just with our students, but with family members as well. So we're at the point in which we're doing a lot of collaboration. A lot of our whole clinical team has worked with training for SEL. We we are boning up, and we invited Stephanie. She came in and she spoke with all the counselors. She's meeting with the social workers and psychologists on December 15th. This is a topic that's near and dear to my heart.
Can you hear me? Okay. Dr. Smith, thank you. Thank you so much for sharing that with us. It's absolutely very important that we bring this information into our school system. Many kids there's so much more stressors in our educational system and just socially that kids have to navigate and deal with, especially their families. And I'm very encouraged and I'm very proud of you and the Mount Vernon community for bringing this knowledge and education not only to staff, but also to families. And similar to the question that I asked Stephanie, when it comes to how Stephanie's experience with Harris, but I know it's also very difficult for family members. So how comfortable do you think are loved ones talking about mental health and trauma with their students and their students? Like, what do you think that we are with that?
So our clinical team, have a lot of experience in this area. I think they're very comfortable. I think that there's a high demand, and that's why we partner with many different agencies to meet the need of our student population. It's unfortunate that there's a stigma attached. Mental health, there has always been a stigma attached to it. So, we try to reach out to our students, but many people are in denial. We want people to be able to get to the root cause of their problem so they can address it and take care of their needs and be healthy. There's no shame to getting help. And so we want individuals to be able to do that so that they can be successful in school. And, let's face it, at the end of the day, we want all of our students to graduate. We want them to be good citizens, move on and meet their post-secondary goals, be it college, be it training, in whatever it might be. We just want them to be healthy. And of course, that has become somewhat difficult because of the time that we're in. So we want students to learn coping skills. We want them to know who to go to. So it's so great that we're having this conversation and everyone's involved in terms of the wellness of our community.
Dr. Smith, I'm glad that you're here and you're bringing all of this up. As an educator myself, I teach at Iona College, and these young adults, I can tell you, from what I'm hearing and what I'm feeling is that you're creating a welcoming, loving, supportive environment where students, if they are dealing with something, that they can come to faculty, they can come to anybody, and even family members can come to the school and get information that they need to support their families. And it's when I say sometimes teachers can be the closest to as family to students as well, and that you're creating this environment for students is great. But you also mentioned that you brought in Stephanie Marcasano, who we just talked to the Mount Vernon School. So I'd like to also bring in Stephanie to help with the conversation. Stephanie, what have you done with the Mount Vernon School District to help bring this message of co-occurring disorders?
So amazingly, a couple of years ago, Senator Bailey had an event at the Boys and Girls Club, and I presented, and I met Maxine Cole-Wilshire, who's the substance use counselor for the district, and we kept trying to find a way to bring me in. And it turned out that the new principal at Mount Vernon High School, we set up a meeting, and we knew each other from a committee in Ardsley, but I really didn't know who he was and what he was doing, but he was the new principal. And he said, I have an idea for how you can present even during COVID. And I thought, okay. He said, I want you to present to the entire high school at the same time. You're going to be in my conference room, and we're going to Zoom you to the entire building. So the entire staff hears the conversation, the students hear it. He's like, and I know you like to meet them. So if it's okay with you, Why don't you do what you usually do? Set up in the cafeteria and stay through the lunch periods. So I was there with Maxine, and we were handing out bracelets and information cards, and they were signing up to start CODA, co-occurring disorders awareness, at the school. More than 70 students signed up. And from there, Dr. Smith said, would you like to present to my team? And I've presented to them, and now I'm presenting to the social workers and psychologists next week, and I'm going to be presenting at the STEAM Academy. And I want you to understand, like, visually, what this means. It means that young people who've never heard of co-occurring disorders, but hear messages like mental health matters and drugs are bad, they can now put the pieces together, look at their friends, look at themselves, look at decisions that they're making around substance use, and understand the risks. And then if they self-identify, if they bring a friend in, if they're doing our CODA Connect, supporting each other and being the link, linking to resources, there are actually resources and adults available who understand, and we can meet the need in the community. And so I got the opportunity to hear from teachers who debriefed with their students about the presentation. They sent me wonderful notes and ideas and thoughts, and how much it connected to them. So for me, that's the home run. I mean, I think you're going to hear from other people that are going to share the other perspectives, but we've now closed the link. Young people who understand, staff and professionals who are willing to support, and then we go the next step, because then we have the providers in the community.
Yes, there's obviously a need in our
I can only imagine what that day was like.
There's a need in our district, and we were so delighted to have Stephanie come in. We want, like I said, for our kids to be well, and we want everyone to understand the signs and know how to be effective in dealing with students.
But I do, before we go to the next bill, I do want to make sure that the audience understands this is not a Mount Vernon problem. This is every school district in Westchester County who we do our youth summit with, and we've had touch time with, and they're trying to get this to expand across the Mid-Hudson region and the state. These opportunities are golden. They plant seeds that grow, but it is not an isolated thing that is happening. So I want to make sure that we're clear on that.
But also, I think I would be remiss if I didn't highlight the fact that Dr. Smith created a space for this to happen. You know, if the school wasn't welcoming, and if Dr. Smith wasn't welcoming of understanding what co-occurring disorders are and bringing that into the school, and bringing in you, Stephanie, bringing in WJCS, who are also going to be speaking a little bit later, and many other providers. But also think about the forum that we're using today through the Mount Vernon Police Department, who is hosting even this conversation. We are doing the right thing by spreading the message, and hopefully by doing so, we're going to get across to the people that deserve to hear this. So again, Dr. Smith, thank you so much. And Stephanie, thank you for jumping in to do what you needed to do to help out the Mount Vernon community, especially Mount Vernon schools. So in moving forward, I would like to introduce Joanne Dunn, who is, again, the Executive Director of the Youth Shelter Program of Westchester. And she can speak from another perspective of the needs of our young adults. Joanne, we can't thank you enough for the work that you're doing for our most vulnerable youth, young people. So can you tell me a little bit more?
Sure. Thank you, everybody, for having me. So I'm actually here tonight to talk about where CODA meets justice. And I think if we talk about this for a minute, I want to stop and say that the exposure that is happening, Mount Vernon, to me, while yes, this is happening in every community, in every situation, Mount Vernon is a chocolate city, and in Black and brown communities, it's been taboo for years to talk about mental health or, you know, or anything of that nature. And so to have CODA and to have a forum where we're pushing out information, we're sharing it, and we're trying to break the stigma and the taboo and really offer opportunities where we're exposing not only our young people, but the community providers, the families. You know, I think that this is huge what we're doing. And I'm here to talk about where CODA meets justice. And as you know, in the justice system, as the youth shelter is the county's only alternative to incarceration program for young people ages 18 to 25 in the criminal court system. And I think where we see CODA is that, as you know, a large portion of young people getting arrested have mental health and substance abuse disorders. And what we've seen increasing is that their arrest or their involvement within the criminal justice system has some correlation to their co-occurring disorders. And many a times what you will find, at least with young people on the back end, and when I say the back end is because we may have not connected them to care while they were in high school or in elementary school, we're seeing that they're not diagnosed or not connected to care. And so what I'm here to talk about tonight is really how in Mount Vernon specifically, we've derived a specialty court here with the local city court judges, with the Westchester District Attorney's Office, in tangent with the Legal Aid Society of Westchester, working with the Mount Vernon Police Department to really look at when young people are arrested and come into the criminal courts. And really what we call this court is a problem-solving court, really to understand that young people particularly need to be connected to care and not necessarily incarcerated, right? And so I will share more as we go along, but understanding that if we can understand why young people are coming into the criminal justice system and understanding that CODA plays a large role into it. I have some statistics that show 75% of the young people that are arrested have co-occurring disorders. They've been not connected to care. 90% of them here in the city of Mount Vernon have not been connected to care. And that's the role that we play as a provider to make sure that they are connected to care. And I think one of the things that we will talk about as we move further along is not only the connection to care for these individuals, but really treating not only them, but the entire ecosystem that surrounds them, because that could be a trigger for them. And so also understanding that these young people need one-stop shopping as well. Many a times they go to drug treatment program over here and they go to mental health program over here. These programs are siloed and not necessarily working together. And I think that's the beauty of Encompass and co-occurring disorder, along with the provider, two of the providers that are here on this table, this forum, the Guidance Center of Westchester and WJCS.
Ms. Dunn, again, thank you for sharing that. So you shared that there is a better, increased awareness of co-occurring disorders that affects those who come to the youth shelter. How have you seen any improvement now with this increased awareness and the message being spread a little bit wider than it ever has been?
I think one, we're understanding, and I think the world is understanding that you can't just punish people for the crime. That if we're really talking about rehabilitation and helping people, when we call restorative justice, we really have to work on the whole person, right? And so understanding that when we connect people to care, whether they're co-occurring disorders or whether there's a housing issue, when we connect them to care, ultimately improves the public safety and the public health outcomes of these individuals. So understanding that that connection to care is important. I think where we're at on the emerging adult justice court is really understanding too, one-stop shopping is important. I think when young people, particularly, they have been attached to so many services or so many providers that you just become another adult in their life. You don't really, you can't really bridge that relationship. And so I think when you talk about vulnerable youth and youth that are cross systems youth, they have been around so many people that when you provide one-stop shopping for them, they come to one place, they get everything they need. They get the connection, they get the engagement, they get the services, they get the intervention, they get the navigator that's also helping them walk through. They get their family support that gets to all of these services as well. That's the difference here that's working in Mount Vernon in regards to the emerging adult justice court. We see that these young people are better off, if that means anything. They're better off because they are connected to one source that is navigating that whole process for them. And for their families, it's a lot easier for them to get involved because they're connected to one resource and not have to follow up with 20 different providers.
Ms. Dunn, again, you touched on something that's very important, which is, again, the treatment piece, but also bridging that gap from two different services where people who are engaged in your system through the youth shelter may be split between either going to a mental health treatment program, a substance abuse treatment program, or many times they don't communicate with each other, which causes a major problem for those people that actually need that service. So so in bringing that up, I'm glad that we have, again, those two presenters, a part of our roundtable, that can talk about what bridging that service looks like and what treatment can look like. So I'd like to bring on at this point Felice Harris from the Guidance Center of Westchester and Dr. Drew Mullane from the WJCS, Westchester Jewish Community Services, to really talk about what does treatment look like right now as it relates to co-occurring disorders, and what are you doing in your respective agencies to address that need?
Felice, did you want to take that? I think you're muted.
I am muted. Hi, good evening, everybody, and thank you for having us as part of this forum. It's definitely a pleasure to be a part of this very important discussion. So I will start by saying that Drew and I, well, Dr. Mullane and I both participate with our agencies in a learning collaborative around Encompass, and we're both piloting the program. And one of the things that we are doing at the Guidance Center of Westchester is working with programs like Joanne Dunn's program. I think it's a great strategy that she has in place. Each child that comes, well, each young adult rather, that comes into placement there is sent over to us for assessment. And I think that that's the key. Once we get an assessment going, we can figure out if they need co-occurring, if they need mental health, if they need substance use, whatever it is. So assessment is definitely the key.
Yeah, I just want to build on that. You know, one of the challenges is, of course, that, you know, when you have individuals that are justice involved, it's not uncommon for them to encounter a lot of challenges along the way, and frankly, to have a number of traumatic experiences. And in those traumatic experiences, and also, as Stephanie said earlier, you know, the kind of spinning your wheels, trying to find traction, trying to find meaning, trying to find something that can kind of help you to feel positive about who you are and where you're going. You know, sometimes what happens is then people become struggle with mental health issues as a consequence. They develop a sense of hopelessness and helplessness about changing their circumstances. Sometimes that results in substance use. And then with those two things happening and, you know, justice involvement, you end up almost feeling like you are, you know, walking on ice and you can't get anywhere and you're consistently falling. And the way the treatment system has historically functioned is that, you know, just as Chris said and others have said, you know, you would need to go to a substance use provider. And they would say, oh, sorry, we don't treat mental health issues. Like, you also need to go to this mental health provider, or you need to go to us and them. And, you know, one of the challenges, of course, is when you have a mental health issue and a substance use issue, they kind of compound one another, right? Like, your substance use makes your mental health worse, and your mental health makes your substance use worse. And so the system in New York State, and frankly elsewhere, has been built around this false premise that, like, you need substance use treatment and then you go elsewhere for mental health. And it's that they're separate issues. They're the same issue. Right. And so, you know, with Encompass, which thank you, Stephanie, and the Harris Project for helping to fund the pilot that, you know, the Guidance Center and WJCS and others are part of, we've been able to use evidence-based practices to tackle these issues at the same time. So, you know, a youth comes in, they have substance use issues, but maybe they don't see substance as a problem. We work with them to help define, you know, how substance use impacts their life, their pursuit of important goals in their life, you know, impacts their ability to get a job or maintain a job, or, you know, to kind of like nullify the strife that they might have with family. And so, Stephanie's efforts to fund the Encompass project or pilot with the guidance centers and others has really transformed, and given our agencies, our organizations, WJCS, the Guidance Center, others, the traction that we need to really help people in one place. And with Joanne Dunn and the youth shelter, that is adding to this so that we can help youth who are justice involved not continue to slip all over the place, but instead kind of get some traction and move forward with their lives and develop opportunities. And that's what Encompass is about. And that's what the changes that are happening in the justice system as a consequence of the work of Stephanie and DC Lackard and of Joanne and the youth shelter and the guidance center, that's all driving this positive change. So we can't be thankful enough.
So can you give us, again, thank you, Dr. Mullane. Always want to call you by the first name, Dr. Drew, and Felice for sharing that. Again, I think I want to step back. When I first started this intro of all of our presenters, remember what their titles are, which is very unique. You really don't hear too many programs that actually have the titles that Dr. Mullane and even and Ms. Harris has. So remember, Felice Harris is the Director of Integrated Services at the Guidance Center in Westchester, and Dr. Mullane is the Director of Innovation, Integration, and Community Partnership. And I'm just bringing it back to that because, as you can see, even in their titles, they have embedded the need for integrated care and co-occurring disorders into just their culture and into their practice. So they're really taking this extremely seriously. But so many people who are listening to this right now, again, may have heard of co-occurring disorders for the first time. And if we're a part of this somewhere down the road again and having this conversation, I'm hoping that we don't have to explain what a co-occurring disorder is, but it just improve and speak on what we're doing to better services for people that live in Westchester County and specifically the Mount Vernon area as well. So let's talk a little bit more about Encompass. Who does it cover? Who's eligible for Encompass? Where is it delivered? How do you access it? I think that if I were a parent or a teacher like I am right now, and I have my students who I can see even for this past semester were struggling with a lot and made it very difficult. It's final week. And a lot of them are dealing with mental health and substance use and have told me because, like Dr. Smith said, we're creating a welcoming environment where now students can have this conversation. So where would I, as a teacher, where would a family member who's listening to this right now refer, and how is it delivered? Can you just educate us all a little bit more?
Chris, I want to just tee it up for a second because I think that, so first I want to say that WMC Health gave us a grant which funded Encompass. So that's sort of the first step. I had heard Dr. Paula Riggs, the creator of the program, speak about it at a conference. I said, if I ever get money, this is what I want to do. Lo and behold, during the pandemic, we got funded. The most important thing to me as a parent who went through what I went through was access. I wanted to make sure that the providers who were delivering it came from different places in Westchester, were able to meet the needs of those with no insurance, those who are undocumented, those who are underinsured, Medicaid, private insurance, private pay. So you could go in with no insurance and get your needs met. You could go to a provider that sees only people who are paying out of their pocket and getting the exact same services. I want the professionals to talk more about the model and why what I thought looked like a great plan and great evidence behind it blossomed into something really incredible. So Felice and Drew.
So I'll just add that Encompass is an evidence-based model. So it's part of the therapeutic process. If your insurance covers behavioral health, that's it. So we are not turning anybody away. If they're coming in the door, you can get the service. I think that really covers who can access the services.
Yeah, and if I can just add, one of the things, I was just on the phone with a parent the other night, and one of the things that I said to her is how proud I am of the system of care in Westchester, because, you know, every organization that's part of this Encompass pilot works so collaboratively. So I got an email from a provider who said, hey, you know, we're not the right program for this person. Could you help? Could you connect this person up? And that was coming at the same time that I was getting a phone call from Stephanie saying, hey, and I got a call from that parent at the same time. And so, you know, this is everybody working together to make sure that you are getting, and your loved ones are getting their needs met. And so I said to the parent at the time, like, I literally just got a phone call from so and so from this organization asking if I could give you a call. And she was shocked by that. Well, at least I think she was shocked by it. I think she's actually maybe listening in on today's session. But it's moments like that where I can be so proud of the system that we have, because, you know, Guidance Center in WJCS aren't in competition. We are all here to serve the needs of the community, and so, you know, ultimately, not one of us can do and meet all of the needs of the community. So the setup that Stephanie brought to the fore is really there. But so when someone walks in the door, right, we're talking to them about, like, so tell me why you're here. Tell me what you want to achieve out of treatment. And so that starts with really helping them to define what the problem is and how substance use fits into it and how mental health fits into it. And then we ask them to kind of set a goal. What is one goal related to mental health? What is one goal you have related to substance use? And what's one other goal that you have? And it's really about kind of building traction with them and being responsive to what their needs are.
And Chris, before you jump in, I also wanted to add that I think also the beauty of having the youth shelter or community provider that is aware of CODA, along with the Mount Vernon Police Department now retooling and retraining their officers to look at mental health and prior to arrest or even while arrest, kind of triaging someone to see, no, they need help. I think that beauty of when you talk about vulnerable populations, having someone who's the navigator, who provides that warm transfer to the guidance center or to WJCS is important, because I look at here, if I was just to send one of my young people to the guidance center, I don't necessarily know if that connection would happen. But because they have a trusted person with them that is making that alley hoop to the guidance center or to WJCS, it makes the transition a lot warmer and a lot smoother for that individual to unrobe, if that makes any sense. So I just wanted to add that as well, because I think what we're doing here, along with Mount Vernon PD is doing in regards to retooling and retraining, it allows for that connection to care to be a lot smoother and a lot more seamless for that individual as well.
Thank you, Joanne. I also wanted to add, and speaking of the system of care, Drew made me think of this when he said that we're not in competition. There have been times when we've called each other and said, do you think you can service this individual? It's not exactly the right situation for them, whether it be for location reasons, transportation, something like that. We've made referrals to one another. Stephanie has kicked off referrals to us. Oh, I was at a school and I did a talk and this parent asked me about services, and she's making those connections directly. And certainly what Joanne is speaking of in terms of the warm handoff, I was coming out of the guidance center not long ago, and I ran into Akil, one of Joanne's workers, and he was like literally there bringing someone to their appointment and helping them to get through the initial assessment and setting up appointments and really helping them to navigate what was going on. So we've become very chummy. We work really well together. I was asking my intake coordinator before I came, how many young people have we taken into Encompass between Mount Vernon and New Rochelle? And over the last couple of months, there's been 44 youth that have been brought into the program and are receiving services. And that is why we do what it is we do. Exactly. It's huge.
And I just want to take a bit of a step back for a minute, because I know there are people in the audience who are hearing like, you don't want to go here for this or there for that. But I want to tell you what the real difference maker is with Encompass. So you walk in, you're engaged, and you decide that you want to do Encompass. Nobody is saying, hammer over your head, this is what you're doing. There's an engagement session. That's number one. Number two, then you're looking at your history. You're looking at when your mental health and trauma things might have happened, where substance use layers in, and you're assessed for your mental health at the same time. Because what I learned, and what many people will share who are in recovery or who have family members that struggle, as you start using less substances, your mental health challenges start to pop. And if you don't consistently reassess and check in and see how you're doing, that's where people fall back on what they know. And if substance use is the only thing they know and you're not capturing them, and I think that in Black and Brown communities, there has always been this sense that a young person is diagnosed with ADHD and they're given a pill and that's it. There's no treatment, just medicate, medicate, medicate. This is a program where a couple of weeks in, a month in, if you need medication, it might be temporary, it might be long-term, it might be a brain situation. It's only introduced as needed. It is not frontline. It is not what we lead with. And so for me, the beauty is that it integrates fully. And the one thing nobody mentions, listen to me, the tox screens are unsupervised. You're like, what do you mean? Tox screens are the big part of substance use treatment. We gotta punish them when they're positive. No, we're not testing people to punish them. We want them to understand what their triggers for use are. If you were abstinent and you've started using again, what was going on this week? What's happening? Or celebrating some reduction in use. It's not an abstinence model, it's a harm reduction model. So it literally flips it all right on its head. And I know we probably want to talk about the parent piece, I'm sure. I'll let you guys go. I'll mute myself.
Well, I just wanted to jump in really quickly because I think there's another really important piece here. Encompass has a very fortunate name because the treatment really is a treatment that encompasses all of the best evidence-based practices for what works in addressing mental health concerns and substance use concerns simultaneously. And so one of those pieces that we haven't yet mentioned that is really important for working with youth across the board, and particularly youth that are struggling with mental health or substance use, is building in positive, pro-social, non-substance using activities, right? When you take away, some coping mechanism, and sometimes substance use is a coping mechanism, sometimes it's not, but when you take away something, some habit, for instance, you need to replace it with something. And one of the things that happens as a consequence of both mental health issues, but also substance use issues, is we tend to build our life around those concerns, around those habits, right? And so we end up socializing with people who have a lot of substance use. And Compass is specifically about let's help you build a life that maybe gives you other options, maybe gives you options to socialize with peers or other people who can help you develop hobbies, hiking, basketball, whatever, arts, that helps you to kind of build a life that's outside of substance use, outside of mental health concerns, and also build in peer networks that are going to help to support your abstinence or your reduction in substance use. So it's not just about kind of building in or going to AA or NA or one of these groups. That's great if you do. But this is also about building a life that gives you more meaning outside of mental health and substance use concerns. So another super great plug for the impact of Encompass, because we expect youth to do 2 pro-social non-substance using activities every week. And when they do that and they come back that they were reported it, we reward them for that, right? There's incentives built in. And so this is just a really exciting thing.
So Drew, you mentioned something, and I have a number of questions I kind of want to throw out to the entire group, and anybody can jump in and answer it. But we talked about Encompass, which is an evidence-based model for youth who are living with a co-occurring disorder, right? And remember, I don't know if anybody who is listening right now, listen to the choice of words that I'm using as I'm describing co-occurring disorders. I said that these youth and adults are living with, right? Not suffering from. It's something that we're coping with, something that we're dealing with, and it's something that you can continue to grow out of. Even though if you may have a lapse or anything, everybody's living with this, similar to how somebody could be living with cancer and living with any other condition, right? We have to be strengths-based in how we think about substance use and mental health as opposed to being so deficit-based, which we've been so historically. But Drew, you talked about when we've been talking about, and Stephanie and Felice and Dr. Smith and Ms. Dunn about Encompass, which we're focusing on the youth. What about the families? So, I'm thinking about myself dealing with a child, and historically we were taught one way of thinking of how to address or deal with somebody who is living with a mental health or substance use disorder, not knowing how to appropriately engage and support. What are we doing for the parents now that might be listening to all of this and we're saying, you know what, this is something new, oh my God, I just never knew existed, I want to get my child connected, right, or young adult, but then what about me? So can anybody touch on that?
I want to jump in here. Last night, our superintendent and our assistant superintendent of Office of School Improvement introduced what's up and coming, and that's the community schools model that's going to be brought to the Benjamin Turner School. And this is basically a holistic approach to dealing with students, and many partnerships will be formed to bring services into the building. So from 7 a.m. to 8 p.m., there'll be services in the building, and of which those services will also be provided to parents. It the it's a reality that, for example, if a kid is hungry, he can't learn. If kids have mental health issues and substance, they can't learn. So the plan is to bring all these services into the building, starting with a Benjamin Turner and possibly going to other schools. But it's going to be mental health programs. It's going to be training for parents. There's a whole host of things that's being introduced. Simultaneously, in terms of parents, they're also starting a resource center for parents where information could be provided. And each of you will have the opportunity to participate in all of these programs so that you would be able to reach out to the parents that have students in our district. So up and coming, like I said, is the Parent Resource Center and the Community Schools program as well. And this will service parents. This is an effort to meet the needs of our students and the community and all stakeholders.
That's great. Thank you.
Mm-hmm. Absolutely. Mm-hmm. Absolutely. So there is a component piece to Encompass called CRAFT that is designed specifically to help the therapist, to help the family and loved ones, significant others to navigate this journey along with the young person that's also getting treatment. So most of us that are doing this work, we build in that family collateral work anyway, naturally as part of the treatment plan. And we are able to, for those, actually, to me, CRAFT is great, even if you're not necessarily working with the individual that has the co-occurring disorder and you're just working with the family. It is just a really, really good evidence-based model. So we are able to build that in for the family collateral sessions for those individuals that are participating in the Encompass program as well.
And just to add to that, I think one of the really great things about CRAFT, which is community reinforcement and family training, yes. It's specifically designed to support parents and other loved ones, concerned significant others, in helping their identified person with substance use concerns enter treatment and stay in treatment. But it's also designed to help those family members, those concerned significant others, to shift their relationship dynamics to favor change right? So you're building a positive relationship with the person who's using substances, and you're also helping them to motivate to enter treatment and stay engaged with treatment and make changes in their substance use. And so that's why craft is such a really important part and partner to Encompass, because it gives parents, it gives loved ones the opportunity to have something that's meeting their needs. Because we see that parents oftentimes are doing their damnedest to help.
Really struggling. Yeah.
Really struggling. And,
Really
and you
struggling.
see all of this stuff out there that says, all right, be really tough with them, be really hard with them, deny them this, threaten to kick them out. And that's all wrong.
I can certainly speak to that. Having been a parent in the system of care, where this is what I now say to parents and to communities when I present to them, is the reason why all of that confrontation and abstinence and contract writing and kick them out and let them reach bottom, it's because prior to now, the system of care stunk. So the easiest thing you can do is deflect, blame the family, blame your ecosystem, and not look at ways to motivate, engage, and to support. And so a lot of the work that I do with families is tied to families who've had touch time with the system and have learned this unhealthy way of relating, and how to relearn it in a way where you can celebrate small victories, where you're not, people say, well, should I kick them out of the house or keep them in the house? Your child can die in either place. What is your tolerance level? Like, if your child had cancer and they didn't want to go to chemo, what would you do? Would you love them harder? Would you support them? I'm never saying put yourself in harm's way, but there are ways to stay engaged while keeping yourself healthy at the same time.
I would also like to add, while I am no clinician, but on the practitioner side, working with young people, I would say that also bridging craft into our work has been important in regards to, we have talked to Stephanie, Drew, and Felice about making sure as a community provider that we are trained in craft, because many a times for young people, family might be a source of trigger. And so for us as CBOs, we are trained in craft because we are that family and that key structure for young people. And so making sure that our staff know when to, like Stephanie said, motivate, engage, and support, making sure our staff are aware of the ticklers or the triggers that are happening with this young person. How do we engage? How do we reinforce the learning or the training that they're getting through Encompass? It's very important. And I would also say, as a CBO, we are also bringing everyone together. So we convene a monthly stakeholder group meeting, and it has about 56 Mount Vernon community providers and county providers. And that's important because everyone is getting trained on CODA. Everyone is getting the information about CODA and also about Encompass. And so when we all as a system start to speak the same language, start to do the same thing, it makes it a lot easier for our young people and our families to be well, because we as a community have the same language and we're speaking the same dialogue. So I just wanted to share that as well.
Absolutely. And I think, Chris, I know that we have our own little chat that goes on. And I just want to make sure that the audience knows that we're reading the questions, which is why without Chris asking the question, we're trying to cover everything that you're all asking about. So keep the questions coming.
Yeah, there's one other thing. There was a question about resources for family too. So I want to kind of put one more thing in there, which is, I know the Mount Vernon School District is a partner with WJCS and DCMH on a Department of Community Mental Health, on a recent SAMHSA grant that is essentially going to provide what's called mental health first aid training to the Mount Vernon School District teachers, paraprofessionals, and across the board. And that's a 5-year grant that's going to really work to kind of build out the mental health resources for everybody across the system. And, you know, I think, Chris, there's also super important developments at the county level, too, in terms of changes that are, you know, going to support systemic change for this as well.
Absolutely. So, you know, it's I think there's so many different areas in which we were trying to tackle and bring education to many different systems related to co-occurring disorders. You know, whether it be with providing trainings to teachers and to other staff, but I think to answering, I do want to jump in and answer some of that, but for the family members in any setting, how are we better educating? And that's one of the questions, and I think it's a very important question. How are we bringing this awareness and education and making kind of a standard practice to family members who may be bringing their child to the school or be connected to that child through the shelter or in any setting? Like, how are we putting this messaging out there so that people are aware and it's in your face? Or just being shared in general. Like, what should a parent or anybody that's listening expect if they're entering into any system at this point?
So if we're talking about the Mount Vernon City School District, as I indicated previously, we have collaborations with again, the Guidance Center with WJCS. We meet with them, we make referrals. Of course, you know, many of our students receive related services within the district, but when there's a need that's really emerging and above and beyond what can be dealt with in the school system, we make those referrals. We also, like I said, open our doors for people to come in and work with students. We have the neighborhood health center in our buildings there at Mount Vernon High School, as well as Edward Williams. So we have partnerships with many agencies. And in terms of parents needing information, all of our clinical team provide the information, and so the parents can access services. They share those information, give the numbers, make the contacts, and you know, we want this to be seamless and a painless process.
You know what? I'm not Dr. Smith. I'm not surprised you were one of the first people to jump in and answer that. You, and along with Joanne, were one of the two that really talked about not only dealing with that person, but also talking about the environment and the systems that they're connected to. So just with you jumping in and saying, hey, you know, if a parent is coming, we are already ready to give messaging and support to that family member. It seems like I'm just hitting home too much with the family stuff, but I'm really not. You know, if you're really talking about that student or that person, young adult, any age that is dealing with something, they trust people in their lives. That is not us. And those people in their lives need to have the information to appropriately support them and also deal with their own frustrations and their own needs and their lack of understanding. So the fact that we are offering craft and any other type of support to those family members, that's how we are also going to be the best way for us to support that person that's in this evidence-based practice, whether it be in Compass or anything else that we're going to bring to the table in the coming years as well that best meets the needs of people. So, I mean, I'm just super encouraged that we can easily say the answers to these questions without having to think about it or think twice, because we're already at a place for that.
We're building wraparound services to meet needs. So when Dr. Smith shared that they're going to open at 7 a.m. and close at 8 p.m., my hope is that, you know, there are other school districts where there are on-site mental health clinics where Encompass is offered in the building. And the beauty of that is you have a working family, you have a single parent, you can't get people to appointments. If you can deliver these kinds of programming in the building, it creates opportunities that didn't exist before. So when we build a system out and everybody is talking about the same thing, that's where the change happens. I know somebody in the group asked about stigma and changing the conversation. For me, if you look at the numbers, I mean, 22% of our youth, teens and young adults, have a mental health disorder with severe impact. 1 in 4 and 1 in 5 of our kids are walking around not feeling comfortable in their own skin. Way more than 70% of those with co-occurring disorders have co-occurring mental health disorder. If we don't start saying, this isn't a reflection of me, this is what exists in the world, that we now have ways to address it. Kids ask me all the time, I have an uncle who struggles with substances and he has depression and he's in jail. I have depression. How am I not going to be my uncle? Your uncle didn't know that he was using substances to manage his depression. He did not know that he was going to begin this cycle of despair and reincarceration. What you now know allows you to change the trajectory of your life. And I think that whether you're an elementary student at Mount Vernon School District or you're a young adult in the youth shelter program, the opportunity to learn and be empowered around this is always there. I mean, there are adults in the Guidance Center of Westchester. My daughter, I don't talk about my daughter's a social worker. Her field placement was at the Guidance Center. She was working with adults in their 50s and 60s and talking about co-occurring disorders in groups. And light bulbs were going off because nobody ever really put those pieces together. So it's never too late.
And I just want to
go ahead, Dr. Millie.
So one of the questions was, where are people hearing this message? And I want to tout three things that are happening. One, Stephanie is all over Westchester constantly doing seriously all the time, doing some presentation on co-occurring disorders. So she is literally beating every bush to get the message out there. Stephanie and Joanne and Felice are working with Judge Rice and the Opportunity Youth Court to really bring this message into the court system so that youth aren't, negatively impacted by additional compounding stressors. And then the other thing that's happening right now, which is a big, big thing, is Department of Community and Mental Health has this ongoing effort to intersect with faith-based communities so that pastors and imams and every faith leader is aware of and talking about mental health and substances and suicidality in their churches, and making sure that we are able to effectively connect people with the idea that caring for one another is an important value that is everyone's responsibility. And so, I think as much as our Surgeon General just announced a crisis for youth, a mental health crisis for youth, there were a lot of amazing things happening between Encompass, Craft, and all of the efforts that are happening in Westchester County and in Mount Vernon. And so there's a lot to be hopeful about.
I just want to add also Mount Vernon Police Department and all the work that they're doing, and even putting on this forum. I know that there's been a lot of incredible work with the Guidance Center and the Mount Vernon Police Department in terms of really addressing some of the behavioral health concerns that are coming up in the community that should not just be addressed from a criminal perspective or law enforcement perspective, but that, also needs additional needs to be addressed from a mental health and a behavioral health standpoint. And I think that work is incredible. I know that Department of Community Mental Health works with Mount Vernon Police Departments as well as other police departments. And I think that initiative is just so worthy of being mentioned at this point. And just to add to that, I've had an experience with Mount Vernon Police Department co-responding to a particular situation. And I was beyond impressed with what I saw from the officers. I mean, really impressed. It was like they definitely are taking training very seriously, and it shows in their interaction with the community members. So.
Felice, thank you for sharing that. I know we're getting close to the end, so I do want to say that as being one of the certified crisis intervention trainers for Westchester County, Mount Vernon Police Department and Deputy Commissioner Jennifer Lackard, when I say that it's one of the departments that really took hold of wanting to create crisis intervention teams and have specially trained officers to have special skills engagement of people and build up a network within the Mount Vernon community for people who are in need. So, I mean, I again, a personal kudos to DC Lackard. But in tying into everything that we're talking about, I know that we kind of shared information when it comes to access and numbers that you should be seeing scrolling in the bottom of the screen. Please call it. But please know that even for me as a Black man, I want to share that knowing that being a part of the Encompass and craft trainings and development of this is also a culturally sensitive and responsive evidence-based practice. We definitely talked about how do you respond to people who are different, people who are treated differently and responded differently as it relates to mental health and substance use as well. So please know that everything that we're talking about is, yes, general with understanding co-occurring disorders, but we are making sure that we are culturally responsive to the Mount Vernon community and others that are out there whose experience of co-occurring disorders could look different, but also the response to that could be very different. So please know that we are really bringing the best of what we can at this point to support people who are living with that. So I do want to bring DC Lackard back in to definitely close out and share her thoughts and her perspective as to what we've been talking about co-occurring disorders and what the Mount Vernon Police Department has been doing to support this movement.
Well, let me say thank you. This has been a great conversation. All of you, Dr. Smith, we want to add you officially to our Behavioral Health Advisory Council because everyone here is a member. So you're like officially now in this conversation. But this is actually, we started this and sort of my work here at the police department is different. It is different from what you would typically see coming from a law enforcement agency. But in the same conversation, I think it is something that needs to happen broadly, right? Not only just in urban communities, but every community, because you have people suffering with mental health and substance use addiction issues all across the country. And there was a question in the chat about why are there so many smoke shops in Mount Vernon when we know that this is an issue? And that is a very good question, right? And there's this dance between commerce and free access to commerce and businesses being able to thrive, and then saying this is not in the best interest of public health, nor is it in the best interest of public safety, right? And how do we merge that where businesses are able to thrive in our community, but not at the extent and at the sake of our young folks who now think that smoking and vaping is cool and this is sort of a culture that they are now a part of. And the conversations about brain waves and how it affects the way their brain chemistry is, that they're too young to think about that because they're caught in the culture of it. And how do we as a community really come together to educate everyone, parents, teachers, law enforcement, everyone that's involved in this, to say, it's not okay. When I started this conversation back a year ago, my comment was, how do we stop the kids from smoking marijuana? Because it is illegal for youth under the age of 18 to smoke. While recreational use is something that we see broadly, the kids say, oh, it's legal, it's okay. And it's not okay if you're under 18, but it is a problem to enforce that. And so when I'm talking to my officers about how we can actually do that, you don't want to criminalize it, but at the same time, you also know that this open window that it is okay is what's allowing the kids to think that this is sort of what they're going to do, and there's no consequence to that. And the smoke shops being all over the community is something that, we're seeing more on a law enforcement side. So there's multiple conversations that need to be had. How do we work together, work out awareness, educational and awareness campaigns, PSAs, make sure the service and the treatment is available. The Encompass model is a great model because mental health and substance use addiction in the same belly, sort of working together, is something that providers don't know how to work, with. How do you do that? Oasis is one side and OMH is another. And now we're trying to morph this in a world. And I think what we're doing in Mount Vernon is amazing. And everyone here today really has shown their expertise, their passion and their commitment to this work. And I want to thank all of you for being a part of this, being our partners, because when we started our Behavioral Health Advisory Council, we didn't know where it was going to go. All I knew was that there's a lot of people out there that's doing this work, and how can we pull them together for the benefit of what's happening in Mount Vernon? And this is an example of what happens when you get people who care to the table to start finding solutions together. And a compass is one of those things that we want to promote large, far, so everyone knows how to do that. But there are families out there that are really, really struggling, and they don't know where to go for help. And I hope that today and this series and this session will help educate and walk people directly where they need to go, and really just get themselves together in a meaningful way. We all have young children. Many of us have teenagers, and we're struggling every day. And it's not the school district's problem. It's not police problem. It's not the hospital's problem. It's sort of all of our problem. And we have to sit down together and see what piece of this problem can we extract and do something about from our lens. But we have to look at it from a macro level, a holistic level, and make sure that the people who we care about are in the best possible shape that we can leave them. So I want to thank all of you for joining me today. I want to thank everyone for joining the Health and Justice Virtual Learning Series. Today was the first of many. This is about co-occurring disorders. We have our esteemed panelists that joined us, and I want to thank especially Stephanie Marcosano from the Harris Project, as well as Christopher John from the Department of Mental Health. The work that you're doing and your support of our work here at the department is also exciting, and we just really thank you for that. I also want to ask everyone to join us and follow mvpdwell.com. That is our new way of communicating to the community what law enforcement is doing on the side of wellness. It is a new stretch. It is a new division that we're creating here in the Mount Vernon Police Department to let the community know that we care about the wellness of our community, how you show up, and how we are able to provide the safety for our community is not just from a law enforcement standpoint, but how do we serve you in a way when we're coming to you in a time of crisis, in a time of need? That's the best opportunity for us to figure out who we can punt to, who of our esteemed panelists we can refer you to, what other providers in the community that we're connected to can we do that. And that's what this wellness division is focused on. So we want to invite you to keep apprised of what we're doing. When you see the next Health and Justice Virtual Learning Series, please join. We will be putting this out. We hope to do this on a monthly basis. So we'd love to see you follow us, and we will follow up with more information to those that have registered. Again, thank you so much for joining us tonight, and we appreciate it, and we look forward to seeing you at our next event. Take care.